Hologic is one of the leading medical device corporations in the world. Yes, they want customers to buy more of their devices, but they are also spending a great deal of time sounding the alarm on the state of women's health around the world through the Hologic Global Women's Health Index. As they report following further analysis, we are not headed in the right direction. And in a ranking of over 50 countries around the world, less than 10% of women say they have actually been tested for cancer. In this iteration of the Swift Hour, I sit down with Dr. Susan Harvey, the Vice President of Worldwide Medical Affairs at Hologic, to really understand how they are letting the numbers speak for themselves on women's health. Dr. Harvey, it is wonderful to see you. Thank you so much for coming back.
Well, thank you for having me. I'm honored to be here, and it's such an important meeting, convening all kinds of people from all over the world to really address the challenges that we're facing globally.
Well, so talk about some of those challenges, because that is really the driver by which you have developed this Global Women's Health Index.
It absolutely is. When our CEO, Steve McMillan, asked the question, what are we doing for the world of women's health? So Hologic being a medical device company championing women, the answer was, well, there isn't really any data. And so that is what helped us build the partnership with Gallup and the index itself, because we know if you don't measure something, you can't impact it and you can't improve it. So by listening to women, we have the largest study in the world listening to women about their health experiences. And the reason this is so critical is that women are the foundation of families, communities, and economies.
What are you seeing as some alarming trends that you're seeing in certain countries and in certain markets in general when it comes to women's health, when it comes to preventative care? What are you seeing as some alarming trends that might surprise people?
So highlights from the 2021 data really speak to this. 1.5 billion women did not have access to preventive care in 2021. So that's more than the population of China. And we're not detecting deadly diseases early in that huge number of women. The gaps between high and low income countries are growing. Disparities are growing. Women's health is stagnant at best and worsening. And as we think about the issues in women's health, they're really global priorities. And women's health is embedded in situations like conflict and global warming and food shortages. And so what we're really bringing to the table is, yes, this is about women's health, but these are priorities that the world has anyway, and we have a format and a platform from which we can actually guide policy changes and actions with the data that we have been able to collect.
How do you, define, what is the most significant lesson you've learned after year one of the index? What is the most, are there things you would do differently with how you analyze the data or how you take it?
Well, gosh, we're looking at the questions for 2023 as we speak. And what we found is the data demonstrated 5 dimensions of health. Those 5 dimensions of health explain 80% of the variation in women's life expectancy. And again, are a framework for action. If you improve even one of those 5 dimensions, then the quality of women's lives and life expectancy will increase. So, Matt, I have to tell you, in some ways, we've really nailed it.
Mm-hmm.
So,
wow.
We were very fortunate. There are some small adjustments. Mm-hmm. I can give you specific examples. We added in 2021 a question about being tested for COVID. We're in the midst of the pandemic. Now what we've learned is that testing for sexually transmitted and infections can get mixed in with testing for HIV alone. So it may be that we adjust questions in this type of way, but generally the questions we've asked have served us very well.
That's great, and I mean that must be very rewarding to see as a result from the index. Talk about some of the countries that performed particularly well and why they performed so well.
Yeah, there's some great examples. So this country scores are on a scale of 100. And each country is scored in each of the 5 dimensions, and then those are summed for a country score. The country score average for the world in 2021 is 53. Every single country has work to do. The range is from 22 to 70. 70 is Taiwan. When a score is higher, women are getting better health care. They have a better safety net. So basic needs are met. Emotional health is supported, and they are more successful at achieving preventive care. In Afghanistan, coming out of continuing through conflict, the survey in Afghanistan was done just as the U.S. was pulling out. Matt, in the area of preventive care, not a single woman that was interviewed in Afghanistan said she had been tested for any type of cancer in the year before. They had the lowest emotional health score of any country in the world. So we see a broad range. We see countries that are doing fairly well in emotional health, and we have hypotheses about why they're doing well. One of those countries is Kazakhstan. They implemented several years ago an adolescent emotional and mental health program, which appears to be impacting now men and women as well as boys and girls 15 and older. They are included in our survey. So we can also hypothesize where countries do really well. How could that be shared and motivate or be used by other countries to improve their scores?
If you were advising other companies, what would you recommend they do if they want to have the kind of impact that Hologic is having with this index?
Yeah, that's a wonderful question. And I think the answer is Hologic has been able to describe the current state of women's health, and we are committed to doing that for years, so we will have trended data. That will be very important. We're able now to measure women's health. I think the question is, what comes next? And the what comes next is we have to convene, we have to collaborate, we have to work together. Hologic can't fix women's health, and yet as we work together, if we're able to detect disease early, could we partner with a pharma company so that treatment is paired? So I think those relationships and collaborations are critical for success moving forward, both in the private sector as well as with governments and NGOs.
Well, you launched the index last year at the summit. You came back this year to talk about some of the initial findings, some next steps. Congratulations on the success of the index in year 1. I understand you intend to do this for a number of years to come.
That's absolutely right. We are committed to do this into the future. And again, the trended data will be so valuable. A lot of investment, dollar investment, but also resource investment, setting up care models, et cetera, are done by governments and foundations. The Gates Foundation gives a huge amount of money, as we all know. Often, the piece that's missing is what's the outcome of that investment? Is it working? How is the healthcare model working? If we get outcome data, we can iteratively improve this and move it forward, and trended data will allow us to do that.
Well, Dr. Harvey, it's been a real pleasure to talk to you today, and congratulations on your session earlier here at the summit, and looking forward to continuing the conversation.
Thank you, Matt. It's a pleasure to be here. We really appreciate Concordia.
Thank you.